Giving back the gift of sight, a medical breakthrough in the treatment of cataracts. Now, it is the most common operation carried out on the NHS. More than 300,000 people every year have cataract operations on their eyes. Now, a new device is being launched that makes the procedure less painful and more effective. Our health correspondent Jane Hughes has been finding out how it works.
Joe Larden's about to become one of the very earliest patients to be treated on the NHS using a new generation of cataract surgery.
So how are you feeling, Mr. Larden? Are you a bit nervous?
Well, everybody's nervous, only when you come into a theatre. You know, I don't care who they are, but that's it.
Mr. Larden's face is covered, but he's fully conscious throughout the delicate process. Just his eye is anaesthetised with drops. Lights out and the operation's underway. The aim is to remove the cataract that's been giving him cloudy vision using just a minute incision, half the size that's made in conventional surgery. The first stage is to break up the cloudy lens and then suck it out of the eye. The incision is less than 2 millimetres across. The new artificial lens is then rolled into a tiny tube inside a needle and injected back into the eye, where it unfurls in the position of the original lens.
And this reduces the amount of surgical manipulation, which gives a potentially better result for the patient. Also, the small incisions potentially can let less harmful bacteria into the eye and reduce the amount of infection.
So it's all over now. It's only taken about 10 minutes. And the big advantage for Mr. Larden is he should be able to see better as soon as he gets off the operating table. And he shouldn't have to come back for lots of follow-up checkups. And that means less expense for the NHS in the long run. Mr. Larden has a cup of tea while he sits and recovers before heading home.
Something has got to be done, and it's very rewarding. I'm so practically better already.
So you can really notice the difference now?
Oh, yes, there's out, yeah.
More than 300,000 of us every year have to go through a cataract operation. It's hoped this new way of doing it will make it a better experience for many more patients. Jane Hughes, BBC News.